I listen to my cardiologist. He's the one that said there's only one guy to go to. That's Dr. Baker at USC. Best decision I ever made in my life.
3 different doctors all said, go see Dr. Matthews. I didn't know where he was. They said, you need to go see Dr. Matthews.
To get to USC, we know that that was a miracle. They went to work right away together and brainstormed and actually, you know, saved her life.
I was having some shortness of breath. Turned out that I was born with a bicuspid valve instead of a tricuspid valve. They needed to change this valve as quickly as possible. At my age, a mechanical valve was one that they used most often. I'm very active, and a mechanical valve didn't fit my lifestyle.
Dudley Duncan had very bad valve disease, and we enrolled him in one of our clinical trials, and I performed an aortic valve replacement on him.
I'm a retired paramedic, and I think that the patient care I got at USC and the attentiveness I got from Dr. Baker were better than anything I've ever seen. It's not like a doctor-patient relationship, but more like your friend or your neighbor.
Cardiovascular Thoracic Institute allows us really, at its essence, to treat patients the way we'd all want to be treated.
The Cardiovascular Institute really grew out of patients who had encountered the system and oftentimes getting mixed messages about what they needed.
What's really unusual about this is the commitment of the university to making this be a patient-centered experience. They take all the subspecialties that relate to cardiovascular disease, cardiac surgery, vascular surgery, cardiology, and they meld them into one unit.
I had 3 arteries that were clogged. I had a heart attack. The other doctors did not want to do it. The other doctor did the actual angiogram. When he got in and saw exactly what the condition was, he stopped and said, you know, we need to talk. And that's when they recommended Dr. Matthews.
We have to be at the top of our game to take on the things that other people either are uncomfortable taking on, don't do a lot of it because it's unusual.
So I can start walking and jogging and exercising.
No, you can't hurt what we did. So there really isn't anything that you can't do. I forgot. Absolutely no house cleaning at all.
That's it.
So we have to stick together. We have to stick together.
We have gone out and recruited all-stars. Dr. Baker is the perfect example. He had incredible qualities as a surgeon, he had incredible qualities as an educator, and incredible qualities as an individual.
It is very comforting to know that when I've got a complex problem, if I have a patient that needs absolutely the best care, that Dr. Matthews is right here to answer his phone.
Dr. Matthews had been in practice here in the city doing outstanding work that I kept hearing about. So if somebody's that good and that exceptional, you've got to have him part of your team.
Big deep breath. We had a lady that was critically ill and needed a valve operation, but was too sick to undergo the valve operation.
When she got here, she was almost ready to pass away. She wasn't going to make it. Dr. Baker and Dr. Matthews both worked together and came up with this plan to have her have a procedure first and then send her home to get her stronger, and then brought her back to do the valve replacement. And all of them working together actually came up and saved her life. You know, we just are eternally grateful to USC for everything, huh, Mom?
Look at you now. You had your balloon done and had your surgery. You look fantastic.
We're all very certain that that couldn't have happened without the 2 of us working together.
They told us we were going to take care of this, and it happened.
Before the surgery, I felt like I was 61, maybe more like 70. After the surgery, I feel like I'm 40 again. I'm doing all the things I did at 40, and I'm doing it better.